Hi, everyone, and welcome to session 3 of Climbing the Hill. This session is about wellness for both the residents and medical students. So today we have Ryan Descamp and Lois Swisher, both of which are physicians who are very involved in the wellness initiative. So Ryan, I don't know if you want to introduce yourself first and then introduce Lois, but it's all you.
Sure. So my name is Ryan Descamp. I am a PGY3 at the University of Chicago here in Chicago, Illinois. I have been involved with AAEM RSA since back when I was a second-year medical student as a committee member on the Wellness Committee, up to vice chair of the Wellness Committee, up to, I believe, chair of the Wellness Committee at one point. And then I was on the AAEM RSA Board of Directors as a board member at large and liaison to the Wellness Committee for 2 years. And now I'm currently the vice president of AAEM RSA and the liaison to the RSA Medical Student Council. And with me here, I'm very proud to introduce Dr. Lois Swisher. Dr. Lois Swisher is clinical professor of emergency medicine and working as a community nocturnist for much of the last 25 years. She's been highly active in AAEM and being awarded the Master of AAEM at St. Louis Scientific Assembly this year. She is currently the inaugural chair of the Women in Emergency section and has been involved in the transition of the diversity, equity, and inclusion from a committee to a section this year. She's been vice chair of wellness and helped start the airway storytelling events that are present at every scientific assembly. She also co-created the National Physician Suicide Awareness Day, which just happened last week. So this talk is definitely timely. And Dr. Swisher, I'm so excited to have you here with me.
Well, thank you so much, Ryan. And I'm really excited to be here too. Because although I've been doing emergency medicine for 30 years, some things happened in my life and I was out of organized medicine. And really, we started about the same time getting involved in AAEM, about 2015. And I think our paths have intertwined. So it's really exciting for me to have this wellness talk. So and this might be a little different than others because we're going to have a conversation. We're sort of in the same place. Let me share these slides here. One minute. So what I wanted to talk about today is when your batteries are empty, how do you recharge? And I think that this is something a lot of us are struggling with, whether you're a medical student resident or whether you're an attending, because COVID has changed everything. I wanted to ask you, Ryan, how have you felt about your batteries? Have you felt like you've been depleted lately?
You know, Lois, I really have. Starting as a third-year resident can be very daunting. Becoming the leaders of the emergency department when you're in a 3-year program, a lot of responsibility falls on the senior residents. We also have new learners coming in and trying to make sure that I'm dedicating adequate time to taking care of patients, but also to the learners and the junior residents on my team, that I'm there for them and supporting them. But in addition to that, you know, COVID-19 and the resurgence of cases has also taken a toll on me. Our emergency department is really busy. We sometimes have 50, 60 patients in the waiting room. And, you know, sometimes we just don't feel like we're well supported and that we don't have the ability to do the job that we train to do. And so, yeah, I'd say that, you know, right now, particularly this time of year, my batteries are feeling pretty empty.
Yeah, me too. I've been doing this for 3 decades, but about 2 years ago, things very much changed for me in my practice. That was the year Hahnemann University went under and we lost our 45 residents, and my practice completely changed. And then not long after, COVID came and medicine completely changed. And so I think with all of this, across the spectrum of healthcare workers, we're feeling depleted. So I want to share a little bit here with everybody about our philosophy, some of mine and some of yours, and then talk about some framework and tools of what we might be able to do and some specific examples. So one of the things that come up on resilience issues is is it an individual thing or is it a system thing? And I think it's gone back and forth a little bit. So where is the pendulum for you right now?
So that's actually a really interesting question. When I first started looking into wellness, I thought it was all personal, that, I was responsible for me. I needed to look out for me, and I needed to have these tools to keep myself well, whether that was practicing mindfulness, healthy eating, good sleep habits, going to the gym, hanging out with friends when I still, had the time to. And then, over about a year and a half later, I feel like my pendulum swung where I started to think, hey, I'm a resilient person. I've made it this far. It must be something else. It's got to be the systems around me that are draining me, because I know I can do this. So if I'm feeling bad, it's got to be because of something else. And now I lay pretty much towards the middle. I think that there's interplays of both. I think that we all work in challenging environments and face challenges, from medical students to first year classes, second year classes, third and fourth year rotations, our residents rising through the ranks, difficult patient situations. But all of those can chip away at us, and we have to be able to put ourselves back together and to make ourselves whole again. So I do think there are some changes that can be made on a structural level, at the hospital level, the residency program level, at the medical student level, but we do still need to work on ourselves as individuals. And I think it takes a little bit of both to reach a happy medium.
I totally agree with you. I am definitely started on the individual aspect of this and working on myself. And then I felt that pushback that people felt like we are the canaries in the coal mine. And it is working in the coal mine that is the toxic part. And that, do I really need to be a more resilient individual? Well, the thing is that it's really hard to change the coal mine. And it's easier to more rapidly change yourself. That is what you have control of. And probably none of us have all the resilience skills that are out there that we can use to our advantage. So yes, I totally agree that if you look at the landscape, you could make this landscape easier in getting rid of the rocks and maybe paving the area, but that's going to take a longer time. And so at the time when you're going through these stresses, and we're going to have a lot of them, not only with COVID, people have malpractice suits, you can have an active shooter incident at a school, and you never know when that's coming. So the more tools that you have individually to be able to be resilient, the better you're going to be able to navigate that terrain. So that's why I sort of lean to emphasizing that for these types of talks. Not that the system doesn't have to be improved. We do have areas that can make a difference, but if you want to be better right now and find ways to ease the pain and the stress, I think it's going to come on the individual level. Another thing that was never really told to me when I was going into medical school, besides that it was hard academically, was that this is a rough road. And I think we're seeing that, of course, COVID is the #1 thing out there. But what are you being told about how things are looking in the future for emergency medicine?
Yeah, it's kind of the same. It's a rough road going through. When COVID happened, we weren't really sure if we were all going to be safe. We weren't sure, we were all pulled off of our rotations and brought back to the emergency department. We were worried about our education. Were we going to miss out on certain rotations? And that was a rough road then. And now we're still trying to figure it out. We're rolling with the punches as COVID comes along. And adding onto it, the stresses of residency and medical school can just compound that. And, me as a third-year resident going forward, I was terrified about the job market. I had no idea what it was going to be like. I know when COVID happened, ER volumes dropped, hospitals went on hiring freezes. And so that was another tough thing that a lot of senior residents are facing is, do I go to fellowship? Or can I even get a job right now in emergency medicine?
Absolutely. This is the first year that I know of, having worked with residents for 30 years, where that job market was in question. It was never a thing before. And frankly, if you do well, get good grades in medical school, you do well in your residency, board eligible, board certification, you are going to be fine. And that is a little more rocky now than it was before, with some of the advanced practice practitioner issues, some of the volume issues. I think we are seeing that rough road, and having the ability to be flexible and resilient, I think is going to be important. And another thing that I was never told in this rough road that we have was that I should learn to protect myself. We have construction workers that have all kinds of protection. They have gloves and long sleeves and the hard hats and being tied into the structures so they don't fall. And these are all really good physical things. And maybe we have a little things that we have physically. Now we have PPE for COVID, but our job is really cognitively loaded. The decisions that we have can cause a lot of fatigue. And if we make wrong decisions, there can be very high impact, not only for us, but for our patients and their families. So I think one of the things we need to change going forward is that not only should we protect ourselves physically, but learn how to protect ourselves with the decisions that we have to make, and that we're able to handle that psychological and mental stress. So now I want to hand it over to you on some of your thoughts of wellness coming from a resident perspective.
Yeah, so what you're looking in front of you is 14 of the 16 PGY3s at the University of Chicago. One person was not there due to being sick that day, and one person was not there due to having just come off an overnight shift. But we had a day where our attendings covered the emergency department, and all of the residents, PGYs 1s, 2s, and 3s, got to have a day with each other. We hung out at the beach. We had dinner together. We talked about the issues that are facing each class specifically with our leadership to come up with solutions. And best of all, we were just all together. And this kind of summarizes, my philosophy of residency support and my philosophy of wellness in residency is being supported by those around me. My residency has this concept called failure friends. And a failure friend is someone that you identify at the beginning of intern year, and you make a promise to each other that no matter when you text or when you call that person, it may take them a bit to respond because they may be sleeping and you guys might be on opposite schedules. But when you text them or call them and you had a bad outcome, you are stressed about work, or you're just feeling like you're a bad doctor or a bad student, they're going to be there to tell you that that's not true. And a lot of times when you tell them what you're going through, they've been through almost the same thing. And that level of openness and that level of support is what's really helped me through residency. And I think it's helped a lot of our other residents as well. Some other things that our residency does is we have residency families. So every family has 1 or 2 attendings, a third-year resident, a second-year resident, and a first-year resident. So it's kind of like a lineage. And it's always fun at the beginning of the year. The new intern gets assigned to the family. You guys get to do a get together to meet everyone. And us as seniors, my senior class made a decision that we wanted to be intentional about checking in with everyone, our interns, our PGY2s, and we actually have our own group meet as PGY3s, and we set a recurring reminder that on the 5th of every month, it says PGY3s, reach out to the PGY1 and 2 in your family, make sure they're doing okay, and give them whatever support you can. And that's a lot of kind of the support that we have in my residency, and it's the support that works for me.
That's great. And I want to ask you, have people been able to see a change in culture, in the way people interact by having these failure friends?
You know, I would say yes. It's hard to tell because I've always been here when we've had failure friends, so it's all that I've ever known. But with talking with individuals at other programs, it seems like we're a very open group here. We talk freely about our mistakes. We don't feel judged by our peers. And if someone shares a bad outcome, no one's going to judge them. And chances are someone's had a similar bad outcome. And it kind of makes you feel like you're not alone, because residency itself and medical school can be very isolating. And so avoiding that isolation, I think, is key.
I think they're great initiatives. I really appreciate those. So I think we have a lot of tools out there. And in 2018, the ACGME instituted some common program requirements for wellness. But right now, I'm not sure that they're as organized as these tools. People are trying different things, and programs may not have a way for residents to think of wellness, to have that architecture to put things, different tools into. So what I wanted to do is share some of that didactic material on how you might be able to frame wellness for you. And I have a couple of different models. And depending on what you're dealing with, one or the other may be more helpful. So one of the ones that I really liked was based off Mashlock's hierarchy of needs. This is for all human needs. The physiological needs of food, water, warmth, rest, taking care of your body, feeling safe is the other basic need. And then there's 2 psychological needs, the feeling of belongingness, which is why the failure friends and the families are great. Things for self-esteem are really important. And then the top one, the self-actualization, feeling that you have a purpose and you're fulfilling that purpose. So a few years ago, the folks at Penn State put together a hierarchy of needs for physicians. And when you go through, you can see how we have had hits to each of these areas. You start at the bottom with the basics. You have access to food, water, time to eat. I know sometimes it's like, well, if I eat, then I might have to go to the bathroom and I don't have any time for that. So I can't drink anything. Or sleep, your bad turnaround times. Are you getting enough sleep? Certainly things like for women, I'm inaugural chair for the Women in Emergency Medicine. Breastfeeding is really something very difficult when you're trying to get seeing patients and your patient length of time. Safety. Well, with COVID, there's the physical safety from the disease, but there's a lot of hostility and incivility out there, much more than when I started. And being physically safe is something that we really have to consider. The respect. I think that we can see that COVID has divided people with masks and vaccines for the respect with our patients. Appreciation. It's hard to feel appreciated when you're doing Zooms all the time. You don't get to be with other people and get to see and talk to them. You're on and off and don't really get that personal interaction. And then that, do you have the resources you need? well, we have nursing shortages where we are. We have patients being held in the ER. I think we really feel that lack of resources more than before. So when you look at this, COVID has hit every single area. So if you've been practicing, so you started medicine from 2020 on, everything's changed. Everybody's feeling this. Our hierarchy, that pyramid, has been totally messed up. And I think you should feel like our wellness has been affected, because it has, and we haven't integrated those new steps. Let me go ahead. So I wanted you to say what I'm in Philadelphia, I'm in an urban area too, but how have you been feeling that in the Midwest?
You know, I've been feeling a lot of the same things, particularly, safety. We aren't sure, do we need a third vaccine? Will we have access to a third vaccine? And then safety in the emergency department is also a big thing. We are a very, very busy level 1 trauma center, and it's not unusual for us to get multiple traumas at a time. And we want to make sure that we're safe and our patients are safe. And respect and appreciation from patients. Like you said, it seems like patients are almost a little meaner these days. I don't know if that's true, but I mean, part of it is, we have long wait times. We have a lot of people coming to our ER. We're sometimes not able to meet all those needs. And, I would probably be cranky too if I was sitting in the waiting room for 8 hours, just to be told, you're okay, you can go home with some Tylenol. But yeah, we're feeling all those things here too. Bed shortages. Sometimes we don't have enough nursing staff. We do the best we can to do what we train to do, which is take care of patients. And that's our mission. But there's a lot of external things that are wearing on these basic needs.
Yeah, there are a lot of things. And one of the reasons that a framework helps is when you start talking to other people, that you have a way to convey that information in little packages so that somebody else can receive them. Are you having basic needs problems, eating, sleeping, taking care of yourself? Are you worried about safety? I'll tell you, just about 2 weeks ago, they changed out our ambulance doors for bulletproof glass because it's there's a direct line into the nursing station. And there is that concern that people have for safety now. So having a vocabulary and an ability to commonly talk about something, commonly talk about wellness, I think is important. Not just that we have this problem and that problem, but how to put it in an area, put it in its box, so somebody else can then take it and figure out what to do with it, rather than it's just, oh, another complaint. So I like looking at the hierarchy of needs for systems. When you're looking at individuals, I think the wellness wheel is an important way to go. We focus so much on the physical aspect of wellness, but there's all these other areas. And I found in the past, particularly with the ACGME, a lot of the physical wellness is emphasized. Sleep, nutrition, safety, and blood-borne pathogens type of thing, how to keep a person physically safe. But these other ones, only since about 2018 have we looked at the emotional wellness. What have you been finding, Ryan?
Yeah, I definitely think that we're starting to see wellness as more than just physical. A lot of the stuff, like you said, the past was sleeping, making sure you can get a ride home if you're too tired, discounts on gym memberships, but the other things weren't really talked about in the context of wellness. They were talked about because they were issues, but we never lumped them together with wellness. But now we're starting to focus on wellness as multifaceted. And you can be really well in one area of your life, and you can be really struggling in another area of your life. And there's different strategies for each different area of wellness. And I think it's really important to realize, what are you doing well and what are you struggling in? Because just because you're doing well on one side of the wheel doesn't mean the other side of the wheel is doing as great.
Absolutely. And mentioned that I helped co-found National Physician Suicide Awareness Day. That is the far end of not being well. When you're thinking about taking your own life, you have gone far down the pathway to have pain, whether that's emotional or physical pain, well beyond what your coping skills are. And so when we talk about this wellness wheel, I want you to think of it not only for yourself, but also for your colleagues. So one of the questions that come up is, when should you ask somebody if they're at risk, or ask them, are they thinking of hurting themselves or killing themselves? And the more specific you are, I think the better it is, so it's clear. And a myth that comes up is that asking somebody if they're suicidal will make them suicidal. It does not. It gives that the light of day, and the ability to talk about it, having somebody open to share those feelings, decreases the sense of suicidal ideation. So when do you ask? Well, my thing is, we're all emergency physicians here, and treat it like anaphylaxis. With anaphylaxis, you give epi when there are two systems involved. When you know somebody's wellness wheel has two systems involved, they may be beyond their coping at the time. They may need a little extra connection. So if you know somebody is going through a divorce, it's probably affecting them socially, in their intimate relationships, financially. It has been really disruptive. And having that person reach out to them can be important. The same thing with malpractice suits. People feel intellectually that people are saying that they made a mistake. The suits that come in are worded to a way that make you feel ashamed, that you're not worthy. There's a lot of hostility and emotional parts of this. So when you know there's that high risk events, definitely reach out. Think about that wellness wheel, not only for yourself, but also for others. So there's some things that you can do physically that act as almost a vaccine. And I think of them as sleep, nutrition, and exercise. And the better you do with those, the better your resilience skills will be. So Ryan, which one do you think is most important for you?
I think sleep is definitely most important. And I think a lot of people would agree with that.
And it's hard in emergency medicine. Have you done any things for yourself for sleep to help?
Yeah, so sleeping for me actually became a pretty big problem throughout my second and third year of residency. During our first year, we spend a lot of time off service where you're on regular schedules, all days in the NICU, all nights on OB, and you follow kind of a regular schedule. We still had those months in the ER where we were swapping between days, nights, evenings, weekends, but it wasn't as frequently. As for PGY2s and 3s, we are spending most of our time in the emergency department. So most of my schedule is flopping between days and evenings and nights, and sometimes not having a ton of time off in between. And you want to help out your colleagues, so sometimes you'll swap a shift and it'll put you in a quick turnaround where you don't have much time to unwind and sleep before getting up for the next shift. And it started to become such an issue for me that I actually talked to my primary care doctor about it. We started to discuss different strategies to help with, preparing my mind for sleep, such as decreasing screen time before going to bed. One thing I actually used to do, which was probably not the best idea, is we have access to Epic on our phones. And it's so we can, take pictures of wounds and stuff. But I would get home and I would, after a couple hours, check up on the patients I had signed out to my co-resident. What was the result of that CTPE? What was the result of that CT abdomen? did that patient have to get intubated? What was the repeat potassium? And those things would just make my mind turn for several hours. You know, was there something I missed? Was there something that I could have caught? And I've had to stop doing that because that was not good for me. And there's always time for learning, but it's not right when you get home from a shift. And then we ultimately decided on some medication to help with sleep on those tough turnaround days when, you know, I need to get 8 hours of sleep during the day and I don't sleep well during the day. So yeah, I had to go for help, and now it's getting better. And I'm really glad I asked for help.
Not surprised he said sleep, because that's what I thought too. I think sleep is really important. And as I said, I do suicide prevention work. I've talked with a psychologist, actually the founder of Gatekeeper Training called QPR, and he's in his 70s. And he says that at one time when he started, when there were individuals with suicidal ideation, they would put them in the hospital, and the order would be for sleep therapy. Sleep is so important, and we really need to do things. I applaud you for going to look for help, because the sooner you can figure out that sleep issues, the better it will be in so many ways. And the better your sleep is, the longer your telomeres stay. It is a lifespan thing that sleep deprivation will make your telomeres shorter and shortens your lifespan. So yeah, it's important. So some things that I've done, because I've been a nocturnist for most of my life, I do the sleep hygiene things of having blackout curtains, white noise. And recently I've gone to theta wave music sounds. I really like that. That has helped me go sort of clear my mind and go to sleep. And I have a weighted blanket. I've now found in that connecting with other people and talking, the internet and Twitter has been great. I found lots of nocturnists use weighted blankets, and it really does help me. So look for things out there to help your sleep. Something we talk less about is things that you can do, tools to increase your resilience. And I took this circle from Dr. Christopher Doty, who looked at the science of different tools that you can use in your practice, in your time in the emergency department, to improve your wellness and work-life integration. So there's several here. I wanted to ask you, Ryan, looking at those, are there ones that you particularly like, and even ones that you wouldn't do?
Yeah, so right away, things like deepen connectivity or speak to me because of all the things I talked about with my residency and the importance I put on my support system and my friends for helping me get through difficult times. And then the other one is, you know, engaging in your environment. It's really hard to have roommates. And I'm roommates with someone who does not work in medicine. And for a time we had a third roommate in our 3-bedroom apartment. And there were times that, you know, during the day, both of them were doing work and I couldn't sleep. But this is their apartment too, and so they have the right to do work here. And so sometimes I have to have conversations that, hey, you know, this weekend I'm going to be on nights all weekend. If you guys could try, you know, not having friends over during the day. At night, totally fine. I'm going to be at work. But during the day, I really need to get some sleep in. So engaging with my environment, making sure that home is my place to recharge, my place to be safe. Because without that, you get a lot of anxiety and a lot of stress around that if you don't have a safe place to unwind. And then managing emotions is the other one. I can sometimes overreact to things. I'll definitely admit that. My friends will admit that. And they help me manage my emotions. They, you know, say, hey, that sucks. I can see why you're feeling that way. I've been there too. And here's what helped for me. And so those would be the ones that I would pick out there that I would say I use most often.
The reason I love this wheel is that not all people are the same. And I am not like you at all. Well, a little bit. The deepening connectivity, I definitely believe in. But I find that whole managing emotions and engaging in the environment a little more difficult for me. I think the reframing thinking is one of my strongest ones, in that I use mantras. For a long time, as I left and put my hand on the doorknob, I said, today I'm going to stamp out disease. I know that I will be able to help somebody with pain and anxiety. I try to clarify my purpose and reframe my thinking as making a difference. My daughter had a brain tumor when she was 5. It's one of the places I could think about this. When I went to tell her that she had a brain tumor, my first words to her is, Tori, there's going to be lots of mommy and Tori days. I just naturally, that is one of my strongest skills. One of my worst is the mindful practice. I'm not good with breathing and yoga. I get in my head a lot, so I think of other things. And only recently have I realized how really important mindful practice is. And so I thought us as emergency physicians, if we stuffed down our emotions, if we didn't know when we were hungry or sleepy and just worked through, we were going to be better doctors. But it's really not true, because when you stuff down all those emotions, you miss the sensations, that the beauty that's going on and things, but also the other side. I find that that's probably why I don't manage my emotions well, is that I don't necessarily feel that heart rate getting higher and my hands getting tense. And by the time there's a problem, my amygdala has run away and taken me with those emotions. And so I am now thinking that mindful practice is a really, really important thing. So each person can decide, in looking at this framework, those things that they would use now, their strengths, and ones that they might use later. I mean, it's taken me a long time to get to mindful practice. Would you want to add any more to that? I know I said a bunch there.
No, I think you covered it perfectly. Great.
And so there's one more framework I want to go to. This is Joyner's theory of suicide. If you are in a dark place, far down the pathway, I want you to realize we as physicians have one strike against us at all times. And that is in these 3 overlapping circles that in the middle go to the risk for suicide or a near lethal attempt. The bottom circle is that capacity to kill oneself. We have the knowledge, we have the access, we've overcome fear of death, we are sleep deprived often, we have the capacity. So it's not surprising to me that physicians kill themselves above the rate of the general population. What I want to emphasize, in those things that you can do, that you really should focus on strengthening, is that connection. And I'm so happy your residency program talks about the failure friends and the families, because it's easy to get disconnected in residency. There is no other perfect way to create an awful situation. We put people into residency, we've torn them from the place that they've known for the last 4 years. And even if you're in the same place, you're with a different group of people. And then we put them on rotations where we mix them up every 3 to 5 weeks. So it is never a stable group that you're with. And then once always are sort of alone and on our different schedule, we then give them high responsibility where they're learning. And in that high responsibility, there's that feeling of failure, that imposter syndrome, that you have spent a lot of money to get where you are, and how are you going to do anything else but this? That sense of burden is really high with that increased responsibility and the lower knowledge. So if there are any things to really focus on, that connection, which is what your residency is doing, is critical. That's key. And anything you can do that there's this, there's a self-compassion website, Kristen Neff, Dr. Neff, talks about a common humanity. And what you were talking about, the common humanity of being a doctor, we're all the same. I remember at the beginning of COVID, there was a guy who came in, there were no beds upstairs. He came in at 4 o'clock with a wide complex tachycardia. Before they did anything, he coughed, he went into a normal sinus rhythm. He was on the amnio drip. Life was great for 12 hours in the emergency department, signed out to me, another 3 hours, went fine. And then he was in a wide complex tachycardia, which he then stayed in for another 6 hours. Lots of things happened, but he still was in it. But when I was getting close to sign outs, I was like, can you sign out a guy in VTAC? Don't you get kicked off the island? Like, how can you be an emergency physician and sign out a patient in VTAC? I just will never be able to leave the hospital. I can't leave. Oh, on the home oral injury, it was the first day I found out we had teleintensivists. We didn't even have real live people in the hospital to help us. And so this guy was going to be mine. Like, I just am going to be here till Monday. It was a Saturday night. And then shortly before I left, I think he moved his bowels and vagaled down into normal sinus rhythm, and I was able to leave. The very next day, a colleague had another patient in a wide complex tachycardia, and he signed the patient out in VTAC. It made me feel so much better. And that person said, "You're taking joy in my misery?" I'm like, no, I'm taking joy in not being alone. I think when we share these stories of the difficult parts of being a doctor, it makes us all better because we realize that what we do is important and it's hard and we're not alone. So connection and purpose. So for sort of the didactic way of thinking about wellness, I think looking at the hierarchy of needs may be helpful when you're looking at your systems, when you're talking to your institution or your residency of those things you need. When you're talking about yourself or one of your colleagues, looking at that wellness wheel is important. And for those in the really dark place, the Joiner's theory puts an emphasis of those things to focus on. So I want to share some practical things that I have done that might not take much time, but if you put a little focus on your wellness, you can really increase the joy in your life. And so this was our s'more tray for a little family get together. It just looks nice. We could have put it out in the box that the chocolate chip cookies came in, but to sit around and have a few minutes and people take a look at that, it made it a little special and it didn't take any time. Recognizing beauty around you. I have started with that mindfulness thing, and I have a friend that was sending a picture to me, and then I would send a picture to her the next day. And as we started exchanging pictures, I started looking for things that were interesting or different or beautiful. And so I noticed this moth on a flower of the next door neighbors. I don't even know if I noticed that the next door neighbor had flowers, except they were so brilliant that day and I needed a picture. I think if you start looking for those unusual and beauty things in your life, you're going to find them. Getting outdoors. We spend a lot of time indoors, and seeing the sunlight definitely changes the attitude. And I've taken to having walks around the area. I found things that I didn't even know existed, like this little waterfall under the bridge there that's just near my house. And by getting out and walking around, getting involved in the environment more. and then plan a special event. This was the Van Gogh immersion experience. About 2 weeks ago, I did this with my family, and I will say I am not a great one for art, but I know my daughter is, and she loves Starry Night. It was so exciting to watch how happy she was and be in this room with all these people experiencing the sounds and the sights, and just being in the moment. It was really an incredible thing. Not too long ago, we had a get together, and trying to use a little creativity. One of my family members made a COVID piñata that was able to have the crap beat out of it, and got a little hostility and a little bit of sweetness out of it. And it was great to see something that was made and creative. Using those little moments to bring people together, I think is really important. So talking about individuals is one thing, but you talk some about things that your residency has done. Are there other things that you know to create these moments or help within the residency?
Yeah, so some other things that, I wanted to talk about is like engaging with your city. We go out and we try and plan at least once or twice a month, a time when all the residents who are off can be together and do something in the city. Like you said, it's really easy to feel isolated in residency, in medical school, anytime you're in a new city. And it's really easy to go to work, come home, sleep, go to work again. But I would challenge everyone to explore their neighborhoods, explore the culture of their city, because that's going to help you feel like you belong there, because you do. But if you're not experiencing those things, then your neighborhood is just a place that you live, and it's not necessarily a home.
So I totally agree with that. I know that there are places that are doing like opt-out EAP visits. Is that something that you've experienced at your place?
So we actually, through our insurance system, get free counseling through our Department of Psychiatry with our health insurance plan. And additionally, GME has mandated that if we, for any reason, would feel uncomfortable speaking with a therapist or a psychiatrist at the University of Chicago, they'll provide a waiver so that we can get those services covered elsewhere, and we can find our own therapist that works for us. We also have an employee assistance program that actually, because of how stressed everyone's been, has started to have in-person like drop-in office hours in the hospital. So a couple hours every week, there's a licensed counselor just waiting for hospital workers to talk to them. It's confidential, it's free. And those are some of the mental health resources that we have. But I have heard of some other places that schedule a therapy appointment for residents. And if you want to go, you go. If you don't want to go, you don't go. But it takes away that barrier of having to schedule it and find time when that's already done for you.
I think that that's so important because it changes the culture. By having appointments made for you and then deciding not to go means that everybody's going, versus having to go because you're having the problem. Then you're that one person that's different. You're not part of the tribe. When everybody's going and you opt out, it's the other way around. And I really think over time, if we start doing that and people get to know the logistics of how to make the appointment and where to go, it will be easy to do that rather than waiting till when they need it. Because we already know when you look at help seeking, the further down you are with depression or problems, the less likely you're going to go. So if you learn how to do it before you even realize you have a problem and you get the logistics down, it's going to be so much easier when you are. So I think that those are great things. There are programs that are doing more, there are programs that are doing less. For those places that are looking to start something that may not be as formal, I have a couple of ideas that you may be able to do. And one is this. There is this website on Positive Cyclopedia. It's called the Year of Happy. And every month it has a different positive psychology focus. The next one coming up in October is resilience, but there's gratitude, there's flow, there's savoring. And I think savoring is one of the best. I never thought of it before. I had been the one, write down 3 things that you're grateful for. Now I like 3 things that you savor, because I think that goes to that mindfulness and being part of the moment and really realizing how blessed we are here, even with all the stress, all the great things we have available to us as a first world nation. This second thing I wanted to bring to your attention is a free resource in learning more about mindfulness, resilience, positive psychology. Coursera offers free, or if you want a certificate, $49 to give you the foundations of mindfulness. There's another course on positive psychology. Actually, they're 5 together, and you can get a concentration on positive psychology. And there is a course called the Yale Happiness Course. Its official title is The Science of Well-Being. And I think if you want to really get knowledgeable about wellness, this is one way to do it. And lastly, I want to bring up the power of moments. Making special moments in your residency, I think, is really important, and in your life. This is a great book, and AAEM had that as the 2 books ago for the Leaders Library. It's definitely something to make each moment count more. So I'd like to just end that as you go on your journey in emergency medicine, there are ways to increase your resilience that will make it easier to get through all the bumps on the road. And these are some of them. They're just tools to make it better. I know that the system needs help and COVID is hard, but if you make yourself a little stronger and help each other, it's going to be an easier road. So thanks for having me. I hope this has been a good time together.
That was amazing. I feel like I got so many insights into both of yours, like journeys with wellness, as well as some tools that I'm personally going to take away into my own life as a resident. And hopefully everyone else who's watching will get something that they can walk away from this lecture with. So thank you for spending your evening with us and all of your insights and vulnerability. I appreciate it.
Well, thank you. I like that approach, going back and forth. I think that that's fun, because I get what you know, it's better than me just talking all at one time.
Definitely.
Yeah, definitely.
Yeah, I've been sitting here the whole time. We don't have failure friends at Temple, but I have an unofficial failure friend, and I'm planning on texting her and saying thank you when we're done with this. So
Start failure friends.
Yes, love failure friends.
The other thing is just be that wellness advocate in your program. Be that person who, pushes for funding from leadership to do wellness events once a month, that brings wellness speakers to talk about sleep hygiene and stress to conference, and just be that advocate. Doesn't cost anything, but it can make some big differences. Absolutely.
You're totally right. Well, thank you guys both so much once again. And we will wrap this up, and this will be posted on the AAEM RSA website for all of the members. So thanks.